Back live with you tonight. The South African Medical Association Trade Union says it has engaged relevant authorities on the issue of unemployed doctors. It says following consultation with the Department of Health, there was an agreement that the ministry will do its job and place doctors. But to date, many doctors remain unemployed while most state hospitals are understaffed. For more on this, we're joined now by Dr Cedric Sihlangu, the General Secretary of Samatu. Dr. Sihlangu, good evening, and thank you very much for your time. In December, you were saying 400 doctors are facing unemployment in 2023. The department said, well, we have not been approached directly by any doctors, but you said, well, we're bringing you those doctors. They've applied, and they said, we'll see what we can do as far as placements are concerned, especially for those who meet minimum requirements. We are now in January of 2023. What are those numbers telling us?
Thank you for having us tonight on your show. Well, the numbers are scary. As we are seated, we have about over 1,000 doctors that are literally languishing, sitting at home and doing nothing. So that really is the biggest concern for us as a trade union for doctors, to say we can't have a government that sits idle when you are facing a healthcare crisis such as this one, and you've got more than 1,000 doctors sitting at home and nothing seems to be done. And you're correctly putting it that this has been since December, and you are now towards the end of January, and nothing really has been done.
So despite your outcry and raising these issues, you're saying that needle hasn't shifted at all?
Not at all, and hence the decision of the NEC, of the trade union, to embark on this National Day of Action, which will be a march really particularly directed to the Department of Health. So effectively, tomorrow, as the 26th of January, marks a decisive moment in the history of the struggle of doctors in South Africa, as we really unite and show collective advocacy, because the critical issue here is really an ailing healthcare system which really affects the poor and marginalized, and this is really what this is about.
So how do you explain a situation where there is an obvious need? I mean, if the COVID period taught us anything, is that there is obviously a need. Our doctors were overworked, were tired, were fatigued, and some of them even got ill. Some of them were even lost because of being overworked and eventually being exposed. Now, we obviously know that the need is there. So is it your understanding that the statement that government is saying that they've got budgetary constraint not true?
Look, one of the biggest tragedies of our time is that those who preside over the public healthcare system themselves do not subscribe to it. So what that means is you've got ministers, HODs and MECs and you name it, directors and chief directors, who themselves sit comfortably with this medical aids that gives them access to this beautiful private healthcare system. So what then happens is they sit rest assured that should they or any of their family members need healthcare attention, they are simply going to run to any of the private facilities and definitely be guaranteed to be seen by a doctor, and in most instances by specialists. A person complaining of a headache will be told, you can see a neurologist. You complain of just a small chest ache, you send to a cardiologist, and in government, our people are not even being allowed to see a generalist. And that's the reality. That's the real tragedy here. That there's no real political will because those who preside over the system, they themselves are comfortable.
So what do we read into this? Those who are presiding over the system, they are telling us, this is what they are telling us. They're saying we don't understand why doctors didn't approach us first instead of informing the union. However, we have recently received a list of doctors from the South African Medical Association Trade Union who need to be placed in public. But here's what they're saying. The department will only be able to assist those who meet the requirements. What does that mean?
It's very strange because, and it's also disingenuous, because you'll understand, it is the very same department that will tell you that there are 2 years of community service which are compulsory, 2 years of internship, which are compulsory, and 1 year of community service, meaning that they've all along had been aware of the cohort that is going through the training platform, going through the statutory requirements, that come the end of that community service, you've got fully qualified, duly registered, independent practitioners, a large number, over 2,000. I mean, we have obviously 1,000 now that's unemployed, but surely you would have expected proper planning. It really is common sense, but again, common sense is not so common. So it tells you that somewhere in the pipeline, someone is not doing their job.
Or is it their expectation that, well, doctors will go find employment? They're qualified, they're doctors. I mean, they can go anywhere in the world, quite honestly. They can even go to private institutions.
But isn't that then the irony of it all, where you are saying there's a failing healthcare system, largely 80 to 90% of the population relies on the public healthcare system. It's largely understaffed. There are no doctors, and then you have the guts as a government to say go overseas. I mean, there's a schism there. There's some break in sequence and logic.
Yeah. So do you believe this national action, this national day of action, will be enough motivation for South Africa's Department of Health to employ more doctors?
I think the point that we need to make crystal clear is that whilst the march comes about as a result of doctors being unemployed, it's really to bring forth the issues of a failing healthcare system. And precisely the fact that whilst you'll have over 1,000 doctors marching tomorrow, and they'll be joined by society at large, where we are saying it can no longer be that we continue every day as if it's a business as usual, when we know that our brothers and sisters, our grandmothers, are not being attended to, and they are dying right within these institutions when there are doctors available to treat our people. And I think what is crucial is it must be addressed, and that's really what this march is about, to bring it to the fore and to raise the plight of not only the unemployed doctors, but of our people, the poor and the marginalized.
Yeah. So the call is not just to the doctors who, of course, have already signed up, but you're saying broader society who are affected by a failing healthcare system should be a part of this march.
Remember, health is a basic human right. Now, if you are deprived access to a doctor because there is none in the facility that you are attending to, that right that you have is invariably being traversed, and that is why it is not only about the doctor himself or herself. It is community fighting to ensure that those rights that we have, those constitutional rights, are respected and provided for.
And what's the response that you have received so far around the march?
We've had an overwhelming response, not only from civil society, but generally from other organizations as well. You'd have possibly seen on social media where various entities and organizations are saying they support this movement, they support this march, because it brings about very critical issues that must be addressed.
Dr. Sihlangu, I appreciate your time. Thanks so much for coming on and your intervention here tonight. That was the South African Medical Association Trade Union General Secretary, Dr. Cedric Sihlangu, on the question of unemployed doctors.